Hi, my name is Jake Greenspan. I'm the director of the Floortime Center, as well as a master level Greenspan Floortime trainer and the son of Dr. Stanley Greenspan. During this extended time at home at the Floortime Center, we started receiving additional inquiries into services and supports for families while they were spending time at home with their children. One of the things we started to hear from these new families was that they were experiencing significant difficulties with their child's behavior or with their child's ability to access and participate in their online or at-home educational programs. While we heard some of these same stories from the families at the Floortime Center who were receiving Greenspan Floortime programs, the numbers of the families and the severity of the challenges seemed to be different. Now, I had not formulated a conclusion yet, but it certainly made me think why some families were experiencing greater behavioral challenges while at home and some families were experiencing less significant ones. As a result, we formulated a questionnaire with a number of questions looking at each child's program from September to February of this past year, as well as the outcomes, especially looking at the areas of negative behavioral increases while at home, as well as the child's ability to access and participate in their online at-home education. While out of the few hundred families we sent it out to, only about 31 families filled out the questionnaire, we saw that even due to a limited population, the results were fairly binary in certain areas. They were very clear-cut. It's important to think about what this time, unfortunately, is showing us, that while children are no longer receiving the structure of a school day, the structure of a program implemented by someone else, a more adult-led program, what happens to the child when they are losing the supports as well as experiencing some of the stressors that we may be experiencing with them at home. This time of quarantine and self-isolation provided us with a window to see how children are going to be adaptable to stress without the ongoing supports of their programs, which is one of the key facets of a healthy social-emotional system and what children actually need to be successful adults. More and more research is coming out proving the fact that social-emotional health and social-emotional skills, especially those mastered and developed before age 5, are the key to long-term success. This questionnaire validates some of those same conclusions within the special needs community. The parent questionnaire looked at the types of school, home, and center-based programs separately that children were engaging in from September 2019 to February of 2020. We then asked these parents to give us feedback across a 4-point scale of how the child was behaving at home, and not just how they're behaving before this and during this, but really we're seeing negative changes, we're seeing spikes in behavior, and also how the child was accessing the educational opportunities online and in person at home. And again, what we saw was fairly binary, especially within two main groups of intervention. When trying to identify the different types of programs and interventions that children were involved in for the first 6 months of the school year of this previous year, we gave families many different options. We included two of the most traditional therapeutic philosophies of ABA and the Greenspan Floortime approach, as well as some of the more traditional programming elements of occupational therapy, speech and language pathology, different educational programs, etc. And what we found is that the results and the answers that parents provided us came back into 3 subgroups of interventions and programs. The first subgroup was a mix of standard care. 12 families fell into this group based on the different programming elements they included that their child was involved with. These elements included behaviorally based special education programs, integrated classrooms, sometimes with shadows or without shadows, occupational therapy and speech therapy programs, or county-based, private, or sometimes both being provided, as well as sometimes at home a few hours, 1 or 2 hours of floor time being provided by parents or clinicians. It should be noted, though, that these families were engaging in these programs and putting these programs together effectively themselves based on the recommendations of other families, doctors, and professionals that they were working with. And these are often very traditional recommendations to utilize a broad range of services that encompass various goal sets that we might have for a child with developmental challenges. And what we found was that families who are engaging in these more self-designed programs that were a mix of standard care did not have significant variations between them in terms of the outcomes we measured. In the second group of families, we saw that ABA programs were the dominant type of program in many children's lives. 12 families fell into this group. Within this larger group of ABA families, we found that there were different amounts of ABA that fell into three subcategories. Some families were receiving 20 or more hours per week in more than one environment, meaning they were receiving it in home, in a center, or at school, in multiple environments. There were some families receiving between 10 to 20 hours in more than one environment, and some families who were receiving less than 10 hours per week in one environment. Now, for those of you that are not familiar, ABA is an approach that works on skill acquisition. It is an adult-led teaching method that uses prompting, repetition, and rewards to achieve specific adult-led outcomes. One of the main goals, especially within school environments for ABA, is something like compliance, sitting down, seemingly paying attention. The definition of these interventions is important to understand because as we look at the results of the data, we want to make conclusions as to why some of the interventions may be more or less effective. And a third group were Greenspan Floortime families. These families were doing 10 or more hours a week, either at home or at the Floortime Center, receiving intensive programs of the Greenspan Floortime approach. These subgroups, whether they're doing it at home or at a clinic, did not show significant variations, which meant to us that the amount of time of floor time and making sure certainly the quality was up to par were necessary, but the location of the intervention did not affect the outcomes. It's important to also understand that the Greenspan Floortime approach is a social emotional intervention. It is also developmentally based and child-centered. This means that instead of trying to teach specific skills, instead of having compliance as one of the primary goals, the goal is to habilitate social emotional health and social emotional skills from a place where the child is capable of beginning. Meaning if a child is 3 years old, but they're still not engaging and interacting at the age of a 2-year-old, we go back and start with them at their developmental age versus their chronological age. This is different when compared to some of the traditional special education goals as well as specifically ABA goals, where they are all chronologically based, meaning a 4-year-old needs to be doing 4-year-old things. Unfortunately, as we know neurologically, that when we try to pull a child up to their chronological age level or skill level, that we do not achieve the same level of neuroplasticity and long-term change as we do when we meet a child where they are developmentally and start from the ground up. This may be one of the explanations for what we're about to see for the differences in some of the outcomes that were shared with us that families are experiencing at home across the two measurements we will discuss. As you can see in this table, we have on the left axis, there are the three different groups of intervention, the mix of standard care, the ABA programs, and the Greenspan Floortime approach. You can then also see the two main measurements we're looking at, the negative behavioral changes and the online at-home educational participation on the top axis. Well, we measured each of these according to a 4-point scale, starting with none, mild, moderate to severe. We found it most helpful to look at the responses into two main categories. Were we seeing no to mild changes, or were we seeing more moderate to severe changes? Was the child enjoying and accessing the educational opportunities or only experiencing mild difficulties doing it? Or were they experiencing moderate difficulties or unable to access the educational opportunities? And as you can see from the percentages, the numbers, the results were pretty definitive, especially in the ABA and the Greenspan Floortime groups. When it came to looking at behavioral changes, and these are negative behavioral changes, these are increases in negative behaviors while at home, which tend to be the most challenging, stressful, and draining part of this time from the feedback from many families that were received. With the mix of standard care families, we saw a 50-50 split. Some families were experiencing more severe changes, some families were not experiencing many changes at all. However, when it came to accessing the educational environment, we found that 75% of the families in this mix of standard care were either enjoying the educational opportunities that they were being provided, or they were only having mild difficulties experiencing those educational opportunities. And 25% of them had moderate or difficulties or were unable to access them. It appeared that this group was having the most ease with accessing the educational experiences during this time at home. Looking at the 12 ABA families, we found that only 25 of the 12, that means 3 out of 12 families, were experiencing none to mild changes in behavior, meaning that only 25% of the kids, 3 out of 12, experienced no change in negative behavior or only had mild changes in negative behavior while at home, while 75%, 9 out of 12 families, a fairly big number, a big percentage, found that there were moderate to severe negative changes in behavior while at home during this time. And even more stark is that 83% of these families, that's 10 out of 12 families, were experiencing moderate difficulties or were unable to access the educational opportunities while at home. Now, this is a pretty significant finding because what it's telling us is that the families who are engaged in primarily ABA programs, and you see the asterisks under the 25%, that 2 of the families were doing floor time at home in that 25% who did not experience negative behavioral changes. Now, those were only 3 families in total. And I will tell you this, of those 3 families, 2 of them also were doing the lower amounts, 10 hours or less of ABA. So what does this mean? Well, one of the things it tells us is that families who were doing predominantly intensive ABA programs were experiencing more challenges while at home, while the intervention was put on hold, while schools were no longer in session, meaning the gains did not carry over. Now, this has been one of the long-term critiques of behavioral intervention, that when you use conditioning, that the location is part of the conditioning experience. And they've even done studies that have found that generalization does not often occur when doing traditional behavioral conditioning for children with autism. And what we're seeing here is more evidence of that being the case. And in the third group, the Greenspan floor time approach, what we're seeing here is that 71.4%, that's 5 out of 7 families, were experiencing no to just mild changes in behavior. Well, of all of the groups, the Greenspan floor time approach group experienced the least negative changes in behavior. Most of them experiencing no changes in negative behavior, meaning that the gains that these children had achieved in self-regulation, decreases in impulsivity, etc., had carried over into the home environment. And about 28.6 were experiencing moderate to severe changes in those negative behaviors. But also in this Greenspan floor time group, that 67% of them were experiencing an easy time accessing the educational opportunities or simply just having mild difficulties. That was 6 out of 4 families. Here you'll notice 1 family out of the 7 Greenspan floor time families opted out because the child was only 2 years old and was not engaged in school. And also we see 33% of the Greenspan floor time families had moderate difficulties or were unable to access the educational opportunity. Based on the data, we can make 3 primary conclusions. Number 1 is that families who focused on a mix of standard care had the most success accessing at-home education, but mixed outcomes with negative behaviors. Number 2, children who did primarily ABA-based programs exhibited the greatest increases in negative behaviors and had the most issues participating in education at home, and that higher amounts of ABA directly correlated with greater increases in negative behaviors. So even among the 3 subgroups of the dosages of ABA, where there were higher amounts of ABA being provided, we saw that the negative behavioral spikes were more severe. And also that the families who had the more mild to no behavioral changes were actually the families who were doing the least amount of ABA, or the families who were doing a little bit of floor time at home themselves. And third, that families using the Greenspan floor time approach at home or at the floor time center saw the smallest increases in negative behaviors, and that the majority had a relatively easy time accessing at-home education. As you can see from the 3 groups, the Greenspan floor time approach had the most well-rounded results, even though the mix of standard care achieved better outcomes when it came to children participating in their at-home education. And the children who are receiving ABA programs had by far the most significant challenges during this time. So why do we think this is? Well, let's take a look at the two more polarized groups, ABA and the Greenspan Floortime approach. These are not just polarized in our data set, but also in society. These two approaches are often at odds because the techniques and philosophies are often very opposite. For those of you that are not familiar with the Greenspan Floortime approach, it is a social-emotional approach that encourages overall social-emotional health instead of teaching specific behaviors as ABA tries to do. Because parents and therapists using this approach do not teach to the test like ABA professionals do, the learning is more likely to be generalized and lead to long-term application. Studies on what's called neuroplasticity, which is how the brain wires itself, not just in the short run for learning new specific behaviors today or tomorrow or next week, or when you're exposed to a prompt, but true long-term learning, remembering to utilize skills and tools when faced with certain situations, that this type of learning occurs best when a child is learning to think, not just being spoon-fed the solution or the answer. Now, when it comes to behavioral conditioning, certain skills can be acquired that way. If we need to learn how to tie our shoes, sure, utilizing a behavioral conditioning approach can be very effective because really we're only going to need one way of tying our shoes. However, existing in the world around us, especially in a world that's constantly changing, where there's stress, where there's the provision of supports and sometimes there's the absence of supports, where people do what we want, or sometimes people do what we don't want, where we can anticipate and expect what people do, or sometimes unpredictable things happen. This is the world we live in. And unfortunately, because the world is highly variable, highly complex, learning to do something one way repetitively does not lead to any form of adaptability. And as a result, what we're seeing is children who engage in primarily ABA programs, or even dominantly ABA programs, where ABA is provided more time during the week than other interventions, we are seeing that these programs are leading to children struggle in the absence of these programs, especially during changes in life. And we're seeing the group that worked on flexibility and adaptability and engagement and communication and building relationships, that this group, the Greenspan Floortime group, did better. One of the inferences we can draw is that because of the big picture social-emotional goals and child-centered thinking-based learning of the Greenspan approach, that the stress and change of being at home and having no supports and therapies and having less structure from no school didn't cause as big of a change in their behavior. Their self-regulation was basically maintained throughout these negative changes. This is a result of the fact that the goals for children receiving the Greenspan Floortime approach are all based on social interaction, creativity, communication, and most importantly, problem solving and adaptability. These are all core tenets of social-emotional goals, and these are all necessary skills that children develop to be successful lifelong participants in society. There was actually a study done at Duke and Penn State that looked at children over 12 to 18 years and found that children who had stronger social-emotional skills and better social-emotional health by the age of 5 were much more successful later in life in the fields of attaining higher levels of education and even getting better paying jobs. They also found that these individuals with greater social-emotional skills had less incidences of criminal activity, substance abuse, and mental health challenges. Now, when we compare the Greenspan Floortime group with children who focus on ABA, which is based on being conditioned through adult prompting and repetition to learn very specific skills, we see the skills that the ABA group had learned did not lead to continued application without the structure of the ABA program being done at home or school at our center. This means there was limited to no generalization and learning that took place after these supports were no longer being provided. After all, what is the point of learning something if we can only apply it in a controlled environment, a familiar environment? If we can't take these skills elsewhere, if we can't apply them during stress, conflict, and change, then it doesn't really do us much good as an individual trying to navigate the world around us. I hope this encourages everybody to ask one big picture question. What are my long-term goals for my child? What is going to lead to the highest level of happiness and success in my child's life in the long run? And as a result, what should I be focusing on currently? what should be the goals of the program and the techniques of the program that encourage the growth towards these bigger picture long-term goals. The Greenspan Floor Time approach is Dr. Stanley Greenspan's version of floor time. We at the Floortime Center utilize his version of floor time, not one of the other versions out there that are still utilizing his principles, but in practice end up looking a little different. If you'd like to inquire about services, please contact me, Jake Greenspan, at jake@thefloortimecenter.com. And also on our website, you'll find additional resources, lectures, and articles that we've put together from many, many, many years of working directly under Dr. Stanley Greenspan while we were beginning our center. In addition, you can also find free and paid for resources at stanleygreenspan.com, where there are free parent lectures as well as an 11-hour professional course and access to a floor time manual. Thank you for your time. I hope this helps.